All right. Hello, everyone. Welcome. We are here today to talk about the U.S. Trans Survey, data about and for trans and gender diverse people. I am so excited to be joined here by some spectacular colleagues and friends. My name is Steph de Normand. I am the manager of our trans health program here at Fenway Health. And I am, like I said, joined by some spectacular people here today that I want to make sure have an opportunity to introduce themselves as well. So I am going to say, why don't we just go with a quick popcorn style? I will call out Sari, since you've got your mic unmuted already. I'll have you go first if folks want to do just a 2 or 3 minute introduction, who you are, what your roles or role is, and why you are here and care about the U.S. Trans Survey and trans data.
Thanks so much, Steph and everybody. Really great to be here. My name is Sari Reisner. My pronouns are he and him. I'm the Director of Transgender Health Research at the Fenway Institute at Fenway Health, which is the research and evaluation training division at Fenway. I am also based at Brigham and Women's Hospital and at Harvard Medical School and Harvard School of Public Health. I'm an epidemiologist by training. Don't hold it against me. I've been doing this work for a while. I'm a person of trans experience myself, so I've been involved in the processes for the USTS for some time, actually. This year, I'm fortunate to be part of the scientific advisory board for the survey, and it's been just such an amazing project, and just watching how these data have informed policy, advocacy, and so forth is really why I care about the survey this year. So excited to have the discussion with everybody. And I will popcorn it over to Julie.
Hey everyone, my name is Julie Thompson. I use she, her pronouns. I'm the medical director of trans health at Fenway Health, and I'm a PA in primary care. I've been at Fenway for the past 12 years. And I suppose my role is really to ensure that Fenway medical providers are confident and competent providing gender affirming care, but I think moreover, also just making sure our health center is a welcoming place, because we know that the interactions throughout the whole health center really influence, folks' experience, but also trust and really the, desire and the willingness to continue to engage in care. And then also to make sure that our health center is an awesome place for our colleagues who are trans and gender diverse who work at Fenway, which is a really important aspect of this as well. And I'm really interested in the Trans Health Survey because it's, in all of the iterations so far in 2011, 2015, it's really influenced the way that I provide care. It influences the questions that I ask, the barriers to care that I consider, and really, what I think is important about people's lives. And think, I've found more and more that it's so important to think beyond the four walls of a clinic visit, right? It's really the lived experience of everyone that impacts their health, mental and physical, and the U.S. Trans Survey really highlights that. So it's so important to the care I provide and really the lives of the community. So this is really good and exciting. And I'm going to pass it on to MG.
Hi, everyone. Thanks for having me. Great to see you, Steph. I'm MG Xiong. I use they, them, theirs pronouns, and I'm the programs manager at the Massachusetts Transgender Political Coalition, also known as MTPC. And we are the oldest trans advocacy organization in the nation, founded in 2001. I just onboarded in June and have had relevant experiences working with the trans community. I'm transmasculine, non-binary myself. I am very excited about the survey. I took it last night, and I think it's a great way for trans people's stories to be heard, like Julie was saying, and for our voices to matter and influence policy and programs. At work, we use the information from the 2015 U.S. Trans Survey regularly, both to inform us on programs that we run and develop, as well as our trainings and education for community partners. So I'm very happy to be here and in community with great people. I'll pass it to Alex.
Thanks, MG. Hey, everybody. Thank you for tuning in. I'm so excited to reconnect with folks from Fenway Health and MTPC. My name is Alex Del Rosario. My pronouns are they, them. I am the national organizer with the National Center for Transgender Equality, where I have been working on all things outreach for the US Trans Survey for over a year now. And so I am really excited that it is finally out. And in the last 30 hours, we have seen an incredible number of trans folks around the country take the survey. Maybe I can share some stats later, but really excited about this conversation and talking a little bit more about why this survey is so important for our community. And Steph, I'll pass it back to you.
Yeah, awesome. Thank you. I am also incredibly excited about this survey. I've already told virtually everyone in my personal life that I'm going to be insufferable in getting them to either take the survey themselves or get people that they know to take it over the next handful of weeks. So I am very excited to be here. Very excited this survey is available. Just a couple of housekeeping things for our attendees here today who are live. We are absolutely happy to take any questions that you may have. You're welcome to submit those through the Q&A, and I will bring those things to our panelists here today. So please feel more than welcome to do so, and I will make sure that they get eyes on those questions. To start out, though, I would love to hear from anyone on any of these questions, and kind of whoever has thoughts, has ideas, things that you want to share. A little bit more about why you would say that surveys like the US Trans Survey are important, and why and how it is helpful for us to have data like this about trans and gender diverse people. So whoever wants to take that and run with it, you are welcome to. This is also a discussion, so feel free to bounce off of each other too.
Awesome. I'd love to kick things off, but and say that the US Trans Survey is really the only survey of its kind. We see a lot of LGBTQ surveys, which are really incredibly important, that touch on mental health, education, etc. But the US Trans Survey is really the only survey that dives deep into the experiences of the trans community. The survey covers 30 different topics, one of them obviously being healthcare. I think the survey highlights some of the disparities, a lot of the disparities that our community faces. And one of the reasons why the survey is so important is because we are able to use the findings to push policy forward that improve the lives of all trans people. And also in the work that I've done in the last year with NCTE, we've met many organizations, nonprofit organizations on the ground who don't have the tools or resources to conduct surveys of their own. And so our hope is that folks around the country are able to use this to improve the lives of the trans people in their own immediate communities.
Thank you, Alex. And building on that, in our community programming, where we run trainings and education workshops for organizations, companies, and different groups, we include information from the 2015 US Trans Survey that is often relevant to their field or their interests and purpose. And what I find more often than not is that the participants in our trainings and education are incredibly surprised by this information, by the statistics that are shown and the data that we have. And so that goes to show how important it is to kind of promote the trans survey and collect this information, because once we are aware that, disappearing exists, marginalization exists, but also the points to celebrate exist. Once we're aware of that, then we have no reason not to do something with it.
I think it's like just building off of that, it's extraordinary because we do know that there are population disparities and inequities that are facing trans populations when we have data that compares transgender and cisgender populations. And a lot of the national surveys don't actually collect data that captures transgender identity or gender identity at all. And in those that do, we really just get, like Alex, you were kind of saying, like the 30,000 foot view, and we don't really have like the richness that this US Trans Survey allows us to get, which is like this very in-depth information to go deep about people's lives and why we might see some of those health inequities. Including, really thinking through things like, education and housing and many of the factors that are sort of non-health related that are important that affect rights. And then also those factors that also do affect health and well-being. The other thing for me is that, I mentioned that the surveys, a lot of them still don't collect information about trans identity, but USTS is designed because folks are so clever at NCTE to benchmark against other national benchmark studies. So like you'll see some of the survey measures are actually the same that are in those studies so that we could say, what is the percentage if they had asked about transgender status that we might have seen, we could be able to see that in this study. So I think that's just so cool. And the community vision for doing that, I think, is really just amazing.
And I'll just say, I think this is, such an amazing opportunity for trans voices to really push the agenda too. This is for communities that have been so marginalized for so long, it's really a place where we can have that voice be uplifted and not, everyone out there saying what we should think about or work on in policy, but really coming from the community itself in terms of what are the issues, what are seen, what are important. I think that's really unique to this study.
Yeah, and it's clear that we work together, Julie, because I was on a very similar thought train of what does it mean for this survey? I know a handful of folks here have self-identified as trans folks as well who are working with this survey. What does it mean for this to be a survey that is really being pushed and being worked on by trans folks also? What are the benefits to that? And how does that kind of influence the way that these surveys are designed? Thoughts, ideas?
Well, I think that there's, my sense is great care taken. I think there's a lot of, people talk about gender affirming care, as for example, but there's also gender affirming research. And I think that, having trans and gender diverse people design and be part of this and do all of it really, I think, helps to ensure that, that this is a gender affirming survey. And I think it's hard, right? Because these surveys are not easy to design at all. And you want people to spend 4 hours filling out the survey, but but we never want to fill out a 4-hour survey. So, but I think, there really is like a lot of careful thought and lived experience guiding the actual design of the measures too, is my sense. And I'm sure Alex can talk a lot more about that and the community engagement piece.
Yeah, building off with what you said, Sari, I think one of the reasons why we've had such an amazing turnout so far, and I think you all will probably be the first to know actually, is that we've had over 19,000 folks already complete the survey, which is pretty extraordinary. And to give y'all some comparison, in 2015, 28,000 folks completed the survey. And so we're already more than halfway there. But I think one of the reasons why the survey has such a strong turnout so far is because of the great care and intentionality that we've put into making sure that this is a trans survey for trans people by trans people. We have partnered up with amazing organizations who have helped steer our outreach efforts, and which is incredibly important. I think sometimes we see surveys being conducted by individuals or groups who don't share the experiences of the communities that they're trying to survey or research. And so, yeah, it's been great and really important that, this survey is led by the trans community.
Yeah, and I think I want to kind of staying focused on that for a minute, and this is probably also a question for you, Alex. I know one of the things that I've already heard from folks who are interested in the survey or curious about it but want to know more is a little bit more about kind of how is this data used in more of a am I safe answering all of these questions way. So if you could talk a little bit more about like,
Yeah.
where does this go and who has access to that?
Yes. So once you complete the survey, the data or the platform that we're using is called Qualtrics. And Sari, feel free to jump in here too, since you are part of the scientific board. But that data will live on Qualtrics, and then what will happen is that data will be transferred into an airtight computer. I think there's a scientific term for it, where the data will live in a computer that's never been opened before and can only be accessed by our team. And when it comes to the reporting of the survey, of the results, folks' data will be anonymous. And so when we write out the reports, folks' information will not be shared. It'll only highlight specific findings and how many people, experience unemployment. 60% of USTS folks experience unemployment. And so in terms of data security and safety, we've implemented a lot of strong measures to protect our community, especially during this incredibly hostile media and politically hostile environment that we're currently facing. And so for folks who do have concerns about safety and data, do know that your personal information is secure and that the survey is anonymous. Yeah. Sari, would you like to add anything?
No, I think you know more about that piece than I do, but I do know that all of the sort of methodological things that anybody has ever done in research to protect privacy is done, and with extra in the case of this. It really has been the most utmost. And like Alex said, there's no identifying information that is in any way going to be stored. And actually, when you're taking the survey, the first page or so, it outlines sort of all of that in the informed consent process. So you can read the details on that if you would like to.
That's awesome to know. And we'll leave a couple of minutes at the end for y'all to describe to folks exactly how to get to that survey, how to fill it out, and any other details that we want to chat about right at the end too. I want to shift a little bit to, because Fenway is a mostly, let's say, healthcare focused organization. I want to shift a little bit. Maybe I'll toss this to you, Julie, first, and then other folks can expand. A lot of the survey questions and a lot of the content here is about like demographic-y type stuff, right? You're talking about like how people are living and their experiences living in the world, not necessarily like getting blood pressure checks or things like that. Why is this kind of information helpful for us in healthcare settings, and how is that important for us to know about healthcare?
Yeah, I mean, I think it comes down to what we term social determinants of health, right? So what things out in the community, what are the experiences that people have in their daily lives that impact their health? And it turns out that these are numerous, right? And I think even highlighted more so. So, I mean, these can be things like access to food, access to secure housing, access to even going to a gym. Can you afford it? Is there one in your neighborhood? Do you feel safe walking down the street or taking public transportation to access these services or to access healthcare? You also want to think about employment, right? Because employment will influence not only finances, but insurance. Are you insured? Are you underinsured? So there's all of these pieces that impact access to healthcare, but impact life. There's something that's called minority stress, which is sort of a chronic level of stress or anxiety that marginalized communities can face due to discrimination, stigma. And we know that through various studies, and Sari, you might want to talk about this, that can also impact cardiovascular health. And so, I think in my world, in the medical world, so often people ask about, well, tell me about the risks of hormone therapy. And I like to think about what are the risks of one, not being on hormone therapy in terms of the stress that can cause, and the significant stress of that. And also living in the world, right? Living in the communities that we live in. And as Alex said, the political stress that's happening right now, our day-to-day lives, and how is that impacting cardiovascular health? How is that impacting coping mechanisms and mental health. And so, asking about, one of the things I love about primary care, I'm not going to go into this too much, is I love learning about people. I love knowing people. I like knowing people over time. And it turns out that that's a good thing. That's really important, because it is these aspects, again, outside of someone's, problem list or medication list, that are so important to people's health. And these things change over time. So when you really get the opportunity to know someone and build that rapport and know their lives, it gives you insight into, the things that might be sort of stressors or barriers to care, or ways that we can talk about something that might impact their health. That's really, again, happening outside in the community.
I mean, I think, to add, there's so many ways that this information is used. And I think, from communities who are, working on the ground and in healthcare facilities and all over the place, I think that's kind of part of the most amazing piece. When I think about the healthcare sector, I also think about training providers. And, I can tell you that a lot of the data that from like the 2015 survey really have provided so much insight for people who are wanting to provide care and do a better job. I think some of the people asking about having experienced discrimination in healthcare, and seeing that statistic really, makes people want to not be in the statistic. They want to be providing good care and competent care. So I think that it can motivate a lot of different ways and put a lot of different pressure points on holding society accountable for equity across a different number of areas and population and sectors.
Yeah, that's great, both of you. Thank you. Because I think that we tend to not think about these things always as like concretely related, right? As things about the way that we live as being related to the exact pieces of our healthcare and what our individual medical folks might need to know. But it is so clear that these things are important when we're thinking about all of it, right? When we're thinking about our health, when we're thinking about population level health, and when we're also thinking about individual people's health.
Steph, hey, I'm just going to jump in one more thing. Can I just jump in one more thing? Sorry, I sort of, Julie did a layup to me and I didn't take it around minority stress. So I just wanted to jump in and say something about that since you mentioned it. And I'm sort of who knows where I was. But I just wanted to just chime in before we move on. Yeah, so minority stress is this idea that people are exposed to chronic different kinds of stressors. And oftentimes minority groups, it depends on the group, also might experience more of a given stressor. So for example, intimate partner violence, for example, can be experienced by everybody, trans and cis alike. However, trans people have elevated odds of experiencing IPV. So there's more exposure to it than cisgender people. But then there's also unique stressors and exposures that we as trans people face. So for example, conversion therapy efforts to try to change our gender identities. That's an example of a transgender specific unique experience that somebody who's cisgender wouldn't have. So USTS allows us to look at those specific unique experiences that no other survey does. So, and that also helps us to understand those factors for care that are very unique that people need to understand in providing care to us as transgender people. I think the other piece is that, because the sample is so big and there's so many intersecting identities and a lot of folks of color, a lot of people from different strata of economics, and a lot of different, we have more sample size to be able to look at people's experiences wherever they sit. So it's not just being a transgender person, but being of whatever race and ethnicity, gender, ability, status, and so forth. So really, I think being able to look at the sort of quilt and patchwork that people's live in, the multiple social locations that people live in, I think is really also part of this that we don't see at all really in healthcare surveys and other surveys.
Yeah, thanks for jumping in with that, Sari. We did get a question that again might fit well for Alex and Sari folks who are really working on this survey, but specifically, I'm going to paraphrase here, but essentially, I'm not sure if I'm trans enough to take this survey. So if we all could think a little bit more, or at least talk a little bit more about, like, what does it look like? How are we thinking about who quote unquote qualifies? And who do we really want to be hearing for? Who is it important to make sure we're having participate?
Yeah, so we want this survey to be as inclusive as possible for folks who are who identify as trans or who are on their journey, wherever you are on the spectrum. If you read the survey and it speaks to you in some, even in a little bit, take the survey. If I think that's the best thing I could give y'all, because you know your gender best, you know your identity best, and if what you read speaks to you in any way, I would say you should take the survey.
I mean, yeah, I think the survey doesn't assume anything really about you in terms of, you know, how, if you want to present in whatever way or anything. So, so I think Alex's advice is the best advice ever.
Yeah, that sounds great. I know the person who I had that question from was thinking particularly about, like, I haven't really done like anything medical. I haven't done any, like, I don't know if I really count or if it matters. But it's good to know that, like, this is really something that we're looking for kind of everybody who holds those trans or gender diverse experiences broadly.
Yes, I just want to say to whoever dropped that question, thank you. That is a question that we've gotten a couple of times, and I hope you found our answer helpful.
Yeah, thanks, Alex. I want to have us zoom out for just a minute and think a little bit more about what does our picture of an affirming future for trans people look like, and how does collecting data like this play into that? I can give you a minute to think about that, because it's kind of a big, heady question. But I think it's one that, like, I enjoy thinking about sometimes, especially when I've had a stressful day or when something's, you know, feeling like I'm really kind of in the work and getting my hands dirty. What does it look like to move forward in the future, and how can data like this help us get there? Anyone have an initial thought?
Yeah, in the community work that MTPC does, we do future dreaming a lot and just visioning to see, you know, what can we do, what's out there. And both this information from the previous 2015 US Trans Survey, as well as our community needs assessment in 2019, that directly informed programs that we are now running. For example, many individuals listed one of their top needs as support in changing and correcting their legal documents with their name and gender markers. And so now we have a program that runs that. You know, we have folks reach out to us and we see the information on how many people need access to gender affirming products such as tucking underwear or binders. And so we develop our programming around this information that that does exist, and from our conversations with community members. And so all of the, or much of the future dreaming and visioning that we do to orient ourselves towards flourishing and trans flourishing in the world comes from having people share their stories and uplift their voices to know, you know, what do you need? What do you want? And we go from there and try and, as best as we can in this world, achieve that affirming vision of beauty for trans people.
I guess my initial thoughts, you know, thinking about the survey, I was thinking about, I think someone might have said accountability, right? That I think the survey does a really nice job comparing some aspects of experience, whether mental health outcomes or medical outcomes, again, where I am in term compared to cisgender communities, right? And I think that is helpful for providers, again, to be accountable for the care that they're giving trans and gender diverse communities versus cis communities. And I guess my hope and dream, right, is that those gaps narrow, right? That we start seeing that the care that we're providing is just as good, is just as full, is just as broad for trans and gender diverse communities. And I think particularly for where I sit in terms of primary care, I really, really want to continue to push this idea that gender affirming care needs to be within primary care. Gender is a part of all of our experiences, and it needs to be something that as care providers, we are affirming in everyone who's in front of us and their experience. And I'm hoping that this survey continues to push the importance of a welcoming environment, seeing people where they are and who they are. And that again, those gaps will continue to narrow.
I think, there is so much hostility in the climate right now, particularly around the laws and criminalizing care for trans and gender diverse young people. It's a difficult time. And I think that this survey can speak, and the data from it can speak to help with that piece and support having legislation not passed. I think that the survey asks people about their experiences, when they were younger. And you can look, if I recall back to my experiences, like when I was younger, let's say, and then, I report which happened to me, that I wasn't able to access gender affirming care the way that I needed to, and that caused a lot of distress in my life, right? That is important for people to know, that the legislators and the whoever needs to know that it's common sense to us, like, of course, but like that we need to make sure that we have numbers to back that up sometimes, unfortunately, for the policy world. So maybe my example wasn't as good because I'm an old fart right now and not a young person in the legislative environment. But the point that I'm trying to make is that all of us, like no matter what age we are, can contribute, because we're talking about our past experiences and our current experiences. And also for trans young people, like that many people move through those experiences, and do end up in great places. So, yeah.
I think my mind went somewhere else, because what I thought about in terms of the future and the survey and the data is right now, one of the main reasons why this survey exists is to highlight the disparities, but I hope one day we can get to a point where we celebrate how far we've come, right? Versus like only 30% having access to healthcare, gender affirming care, maybe it's 95. And so I hope, when I think of the future and what I'd like to see and what I hope for our community, I hope that the survey becomes something where we can celebrate where our community, where we land in the future. So
I'll share my own thoughts on this one too, because it's something that I like to think about. And I think that there are two kind of initial things that come to mind for me. One is around our trans elders, and having more of them, in just a straight up and down, having more trans elders, being able to see more and more people who are out in the world living their affirmed lives, and who make it to being elders. Like, let's be real about the status of what it is like to be a trans person in the US or in the world. Having more people who are engaged and who are able to make it to those old ages is something that I think about a lot, and that every time I'm looking at those different pieces of that data and seeing just like how little data we have, I'm reminded that some of it's because we just don't have as many folks who made it that long. And I'm excited to see more and more people who are engaged, but also more and more folks who are making it to be able to be engaged in that data. The other piece, as you were speaking, Alex, I was thinking about one of my, similar to what I think MG was saying, not infrequently use the 2015 data when I'm doing different kinds of training and kind of there's an activity that I like to do around just guessing statistics. What would you guess would be the statistics compared to, a US national baseline average for trans and gender diverse folks? And one of my favorite things to always include in that is, I think it was the reported registering and voting in a midterm election that was around the corner at the time, and how much more engaged trans and gender diverse folks were than the baseline US population. And that's like one of those little pieces that I really like to think about the ways that, like, what are those pieces that we can continue to show, like, trans folks are not only here, but are actively engaging in the world, and disproportionately more, right? We are more active, we are more engaged in shaping what our futures look like. And I love to continue to see more and more ways that, trans and gender diverse folks are not only flourishing in their own lives, but also shaping what our future looks like. Those are things that I love to see, that I love to kind of latch on to those little bits and pieces. And we don't know those things, right? Unless we do these huge population size data analyses to try to see some of these differences and things. We are getting close to the end of our time. We've got about 10 minutes left. I know these things always go fast, but I want to make sure that we have a couple of minutes to think, first of all, to see if anyone else here has any things that you think are relevant to thinking about, if I am someone who's watching this either right now live or in the future, is still trying to decide, is it worth me filling this out? Like, why should I bother? Or is it worth my time? Is it worth the energy? What does it mean? I mean, I know for me, like, I always feel really excited to engage in this kind of project, but if we can talk a little bit more about, like, what does it look like to be engaged in community in this way? What does it look like to be participating in research this way? What either excites you to be engaged in this space? And I know that was a lot of different questions. That is kind of asking the same thing, but I think you get my gist. What are the things that get you excited about this area, and would be your plug to get someone to really get excited about it?
I think for me, what gets me really excited, I just imagine thousands of trans folks around the country hanging out with their friends or sitting at home, filling out the survey, doing their part to improve not only their own life, but also the lives of our entire community. I also think about how this survey is done every 5 to 7 years. And so I think about, right, a lot can happen between now and the next time the survey is conducted. And so for me, what would make me want to take the survey is making sure that my voice is heard, because a lot can happen that could impact my life between now and the next trans survey. And so, yeah, and also I think you touched on this, Steph. The survey is a little long, and so for folks who are listening in and do have thoughts about, the survey is too long, do know that you are able to pause the survey. And so if you need a break, maybe you're going to take it this evening, and then you might want to go to bed, you can come back to it tomorrow. Just leave your tab open. But yeah, when I think of what excites me, I think about our community and this being an act of solidarity and love.
Yeah, I love that. The act of solidarity and love. That was exactly what was going through my mind. And yesterday evening when I took it, I honestly felt very special. I did. And I think it's such a great way to feel connected to, just by today's count, 19,000 other people across the United States. And at MTPC, many people reach out to us for ways to get involved and, volunteer. And honestly, this is a huge way to be involved with your local and broader trans community. I think I feel very fortunate in that I am surrounded by trans people all day, almost every day. And For folks who may not get to share those experiences, this is certainly a way to do so in another fashion.
I'm echoing the same sentiment because it is, I think, feeling like, being a part of something bigger, making a contribution to be part of that bigger picture and bigger community. And yeah, I felt that today when I took the survey. I really did feel connected. So that's pretty awesome.
I do really love that picture too, of like, almost like in a scene in a movie where it's zooming out into like all of these different people sitting at computers, all filling out the things at the same time. Like, I love that idea. I love that concept. So many people coming together to really, as a community or as communities, right, to give us the information that we need to make all of our lives better and to make sure that our real experiences are represented in the world, in the data, in the way that we then approach all of the different things that each one of us kind of represents within our, quote unquote, day jobs, of being able to use this data in various different ways. I know that I've talked to plenty of folks who this data has set, like you said, MG, kind of like community-based programs, setting research priorities, being used in training and education, and all of these different facets. Being able to have data that's good. I don't know if you can necessarily have data that's correct. That's a weird way to phrase it, but data that's really authentically representing the communities that we are all living within and serving. I love that idea. I love that that picture. I did say that I would give you, Alice, at least a handful of minutes to talk to people a little bit more about the who, what, where, when, how of the survey. But I want to pause just one more minute, see if anyone else here has any last comments, thoughts, anything that they haven't gotten out quite yet that they would love to share about the survey or about our discussion topics today.
I just wanted to mention briefly that if people need the equipment or a space to do the survey, the MTPC office located in downtown Boston is open and available, and folks can just shoot me an email. Steph, you're more than welcome to share my email out with participants, and we can set up a time to take the survey.
That's awesome. Thanks, MG. Anybody else before we turn it over to Alex to wrap us out? Alrighty, tell us all about it, Alex. How do we do it? When, all of that? How long does it take? All that good stuff.
Yeah, first off, I just want to say I really appreciated our conversation this evening, and I hope that we have more opportunities to connect outside of the survey as well. But yeah, US Trans Survey is out. It's been out for about 32 hours at this point. And it'll stay open until November 21st. And so just mark your calendars. We do recommend folks to take it earlier than later, just in case you forget. The survey can be accessed at ustranssurvey.org. It is also mobile friendly. And the survey is, you can take the survey in English or Spanish, whichever you prefer. The survey, as I mentioned, covers 30 different topics, and depending on your life experience, it could take about 30 to 60 minutes to complete. So for example, my survey might look different than MG's survey, and it really depends. One of the reasons why the survey is not or why the survey is only available online is because there is a comprehensive skip logic that's built into the survey, and it's hard to translate that over paper. For folks who aren't familiar with what a skip logic is, it's essentially a logic that's built into the survey, and depending on how you answer a specific question or section, you might not get the following question or section. So for example, if I get the question, did you ever serve in the military? And I say yes, then I'll get the section on what it was like for me to serve as a trans veteran. If I say no, then the survey will read my answer and skip that portion. So it really depends. The length of the survey depends on your life experience. And then, as I touched on earlier, you can pause your survey and come back to it later. And essentially what you'll just have to do is leave your tab open and come back to it. Your page shouldn't time out. If it does, please let us know. And if you do have any questions about the survey at any point, you can reach out to us at ustranssurvey@transequality.org. We are really open to feedback. We want the next survey to be better. So if there is something that you felt like was missing, please share that feedback with us, and so that we can make the next survey better than this survey. And I think those are my main highlights. If you do work with an organization and want to become a partner, let us know. We'll send you our outreach kit. It's our one-stop shop for all of our partners. It's got social media graphics and content that you can use to get the word out. And I know that MG, you're hosting some survey taking stuff. For folks who are also interested in hosting a survey taking event and would like to rent out tablets, that's also something that we can help out as well. But I think that's pretty much it. I just want to say thank you again for sharing your story. It's incredibly important, and the 19,000 folks that have completed this survey really highlights the excitement and need for this survey and this data. And so I really want to say thank you again. And I will turn it back to you, Steph.
Yeah, thank you so much, Alex. And thank you to everybody who is on this panel today. It is absolutely great to hear from all of you about how important this survey is, how important getting this data is, and how to participate. So at here, I want to make sure that we are respectful of folks' time and wrapping on time. So thank you to everyone who has joined us, to everyone who is watching the recording, and to everyone who has taken or is about to take their survey. If you have any questions, as Alex said about the survey, feel free to reach out to them. And otherwise, I hope that everyone has a spectacular night, and we'll look forward to seeing you around soon. All righty. Have a great night, everyone.
Thank you, everyone. Thank you, Steph.
Bye. Thanks.